For 9 months, the focus was on the pregnancy. You have heart scans, vitamins, constant checkups. But then, the big day arrives, the baby is here, and now all the attention shifts to that beautiful new life in your arms. At Guinea Savannah Medical Center, we believe a healthy baby needs a healthy mother. The 6 weeks post-delivery, which we call postpartum, is one of the most physically and emotionally demanding times in a woman's life. Today, we are going to talk about why your postpartum care is just as important as your prenatal care and the signs you should never ignore. Whether you had a vaginal birth or a cesarean section, your body has just completed a monumental task. The uterus, over the next 6 weeks, your uterus is shrinking from the size of a watermelon back to the size of a pear, and even less. This involves after pains, bleedings called lochia. It is a healing process that requires rest. Won't care if you had a cesarean section or stitches. These are major healing sites. We need to monitor them for redness, swelling, or discharge or infection. The rest meet. In our culture, there's a lot of pressure to get back on your feet immediately after giving birth. But I tell my patients, for the first 2 weeks, your only jobs are feeding the baby and healing yourself. Over-exertion early on can lead to long-term pelvic floor issues or delayed healing. The baby blues versus postpartum depression. Your hormones are currently in a state of free fall. It is completely normal to feel weepy, overwhelmed, or irritable in the first days. This is called the baby blues. However, if those feelings last longer than 2 weeks, or if you feel a sense of hopelessness, a lack of connection to your baby, or extreme anxiety, you may be experiencing postpartum depression. Postpartum depression is not a reflection of your ability as a mother. It is a biochemical complication of childbirth. You don't have to tough it out. Speaking up is the first step towards feeling like yourself again. There are certain signs that your body is in trouble. Please, if you experience this, do not wait for your 6 weeks checkup. Postpartum hypertension. If you have a severe headache that won't go away or a blood vision, including protein in the urine, it could be a postpartum preeclampsia or just postpartum blood pressure rise. This is a medical emergency. Heavy bleeding following delivery within 24 hours, when the amount is probably 500 mils and above following vaginal delivery, or more than 1,000 mils and above following cesarean section, there will be need for that emergency to be handled, because that's what they call primary postpartum hemorrhage, and that is the major culprit killing our women, especially in sub-Saharan region. Fever. A temperature over 38 degrees Celsius could indicate a uterine or incision infection. Leg pain. Swelling, redness, or pain in just one leg can be a sign of blood clot, or DVT, called deep venous thrombosis, because your blood is thickened after pregnancy. We take this very seriously because it's actually difficult to handle. Postpartum care is also about refueling. You are likely sleep deprived, and if breastfeeding, your body is working overtime. You need more calories now than you did during pregnancy. Focus on proteins, iron-rich foods to replace blood loss and massive amounts of hydration. I want to speak to the husband and family members watching this. You are the village. Your job is to mother the mother. Ensure she's eating, hydrated, and getting stretches of sleep. Your journey doesn't end when the umbilical cord is cut. It is just the beginning. At Guinea Savannah Medical Center, our postpartum care is designed to catch complications before they become crises and to support your transition into motherhood with dignity and expertise. I am Dr. Phillips.